Thank you so much, Sean. Medicare Open Enrollment is well underway. This is the time to make changes to your plan and shop through coverage. Now is the time to do it. Here to explain why it's so important, Matthew Engstrom and Dr. Scott Mancuso, Senior Medical Officer with CareMore Health Plan. Good morning to both of you and welcome.
Morning. Thank you so much for having us.
Now, Matthew, let's start with you. Tell us why Medicare Open Enrollment is so important and what it is.
Well, every year from October 15 until December 7, this is the time of year when the majority of people who have Medicare can review their plan options, they can make changes, they can add coverage, they can delete coverage. And it's very, very important that this time of year people pay attention to their plans, the options out there, and they need to make a decision. Are they going to keep what they have or go with something else?
And this is the time of the year that they can do it. This is the period of open enrollment.
Yes. Yes.
All right. And again, it closes when?
December 7th.
December 7th. So it's just around the corner. So people really need to start making changes if that's what they want to do.
Exactly.
Now, what are some of the obstacles people face?
Well, this time of year is a great opportunity for folks who are unhappy or for folks who are looking for something better out there for their individual needs. I often tell people it's like drinking from a fire hose. There's a lot of information out there, and what you really want to do is look at a plan that has a good benefit structure that you're happy with, that provides you good access to physicians that you want to see. Also take into account how it covers medications. Medication costs can be very important for our senior members. And then most importantly, the question that we would encourage people to ask themselves is, does the plan I have or the plan I'm looking for do anything to help me get healthy or stay healthy? Those things are very, very important.
Lots of things to look at and think about as well.
And that's what really separates CareMore. You know, as a physician myself, I actually see CareMore members. So CareMore is much more than just a health plan that distributes benefits. We're actually a healthcare delivery model where you can actually come and see a CareMore physician as well as nurse practitioners, and a whole interdisciplinary model of psychiatrists, nutritionists, social workers, case managers. We all work together and we're a part of the community.
And that's what really makes you different and sets you apart from, let's say, another company.
That's exactly right. We have our primary care networks in the community like every other health plan, but at CareMore we have 3 large care centers here in the Las Vegas area, and in those providers that I just mentioned, we operate out of, and our primary care physicians refer their members to our care centers, and we're able to manage much more than just the physical aspects of healthcare, such as diabetes and hypertension. We actually focus on behavioral health issues, psychiatric problems which often become a problem for the elderly, such as cognitive problems, depression, difficulty sleeping. We also have social services that we deploy as well, so we do home visits. We think it's important for us to partner with communities, vendors such as Meals on Wheels. Nutrition is an incredibly important part of healthcare that's often overlooked, so we make that an important part of who we are. We also partner with vendors and community partners in terms of placing our seniors into different levels of housing that they may need as they mature.
And as you know, as a physician, seeing these patients at the beginning stages, let's say, of a disease is so much cheaper to treat than letting it go and go and go.
You're exactly right. And the healthcare in this country is fantastic, as you mentioned, of treating the episode of care. So we do a great job of doing bypass surgery, but what this country doesn't do well is preventing our patients from needing the bypass surgery in the first place. And that's what really separates CareMore, is our aggressive approach to wellness. And we look at wellness not just for people that aren't on any medications who golf 3 times a week. We manage them very well. We prevent them from having disease. But what we do extremely well is manage our diabetics, COPD patients with lung disease or kidney disease patients. We prevent those diseases from getting out of control and progressing to more severe downstream complications that actually limit your life and affect your quality. And that's the most important thing for us at CareMore, is maintaining that excellent quality of life, keeping our patients out of emergency rooms, preventing them from needing to be in the hospitals in the first place.
And where is CareMore located?
We have several locations throughout the valley. We have a couple clinics, 3 clinics here in town. We have one at Tenaya and Smoke Ranch, Flamingo and McLeod, and then at Green Valley and 215 in Henderson near the Smith Shopping Center. As Dr. Mancuso mentioned, these are state-of-the-art medical clinics that our members have access to, and all the things that he mentioned are taking place. We're really putting a lot of effort and focus and resources into early prevention. We help improve communication with patients and doctors, and we also do a fantastic job of not only keeping people healthy, but getting those who aren't healthy towards better health.
Yeah, getting them on the right track.
Yes.
And oftentimes people feel like, oh, they're embarrassed about their condition or they don't really know where to turn, but you're there to help them and guide them through every step that they need to go through.
That's the goal.
Right?
That's right. And our physicians actually that see our patients in the care centers that I described, we actually go into the hospital and manage our patients during their hospital stay when you're at your weakest and most frail point. 20 years ago, primary care doctors used to go into the hospital and take care of patients. Those days are long gone. CareMore brings that back. So I see my patients in my clinic, but I also follow them into the hospital and manage them throughout their entire hospital stay, and that's very important to them.
Yeah, people don't want to be treated like or felt like they're a number.
That's exactly right.
Yeah.
They're people.
Exactly.
And going through these conditions. Now you have something fun going on. You're doing a pie giveaway?
Yes.
What is that?
Yes. Well, as focused as we are on health, we think it's very important that we celebrate the holidays. So coming up next week, we'll have some pie giveaways at the Smith's grocery store in Flamingo, and also we'll be doing them with Mariana's grocery stores next week. It's a little ironic because we're so focused on health, but moderation's the key.
Yes.
And so we're going to be partnering with the community in these different grocery stores.
You can share the pie. You don't have to eat the whole thing.
Exactly.
Right. Thank
and then
you
just
so
go
much.
walk after
Yeah,
you're done.
exactly. Thank you so much.
Thanks for having us.
Medicare Open Enrollment is happening right now. For guidance, give CareMore a call. The number to reach them and a website right there on your screen. They are at Tenaya, north of Smoke Ranch.